Hey, what's up? Barnaby here. So you want to know more about ADHD? You know, I'm talking to Dr. Jeffrey Chamberlain, family medicine specialist in this HelloLife moment. You know, it seems that ADHD is kind of a catch-all. It's an umbrella, and it's easy to just say, that must be it, when there are other things that it could be, right?
Exactly. It's easy to label someone as ADHD. Just, oh, this person's hyperactive, let's call them ADHD.
Right.
But you really don't want to miss something else that's going on and start treating for ADHD and missing something else. For kids, a lot of times we want to make sure, do they have a learning disability? Do they have problems with their hearing or vision? And so are we calling someone ADHD who really has some other problem?
Yeah, because I know kids in my past, and it was that they would be the class clowns, that they would try to divert attention from their perceived stupidity because they weren't getting the lessons because of possibly vision or hearing, and they would just act out, and so the teacher wouldn't even want to call on them anymore, and they would just kind of get pushed through as a marginal student.
That's right. So if we have a kid who we think has ADHD, we want to make sure we're not missing those things. There's a disorder called Asperger's disorder, which is related to autism, and it has some features that are similar to ADHD, and so sometimes people with Asperger's get labeled ADHD, and they're kind of missing the boat, and then it's not till later that we figure out that they have Asperger's. So it's important to make sure that you don't have something else like that.
And I mean, it could boil down to something as simple and tragic as emotional issues.
Exactly. A lot of times depression, instability in someone's life. If a kid has a lot of changes going on in their life, a lot of times that can cause a lot of problems, and treating with medications isn't going to solve the fundamental instability that's at home or going on in their life.
Yeah, and even, I guess the problems could just start at the table. Are they having a good breakfast? Are they having just a sugar-laden diet? Do they exercise at all? There's so many variables here.
Exactly. Diet could be an issue. It could be an issue of just the kids used to doing whatever they feel like, and so all of a sudden they're in an environment where they have to sit down and they have to learn how to do that. You know, for adults, it can have some of the similar issues. I've had adults be diagnosed with ADHD, but it was really a drug abuse problem that they had, and they got off the drugs, and all of a sudden now they can concentrate better and do a lot of things that they couldn't do before.
Well, it seems like if you're going to diagnose this correctly, it demands honesty. You have to take a hard look at yourself, or if you're the parent, a hard look at your kid, and be ready to admit to some things.
Exactly. It does.
Yeah. Well, I'll tell you what, it's all good stuff, per usual, right here with Dr. Jeffrey Chamberlain. This HelloLife moment, because we're all about matching your commitment to a healthy lifestyle